Persons with disability have not been left out, as majority of these persons living with disability had difficulty in adjusting to life during the lockdown at the peak of the COVID-19 pandemic. Adhering to the safety protocols and assessing government social intervention program became a challenge. My colleague Sarah Parku tells the story of Sylvia Pepra, a deaf and blind level 400 student of the University of Education, Winneba, whose life was impacted by the pandemic.
Persons with disabilities comprise an estimated 15% of the world's population. 3% constitutes Ghana's total population of about 30 million. However, access to education and health care remain their greatest challenge. People with mobility challenges and had relied on others to move had their lives disrupted significantly due to the imposition of restriction orders and physical distancing measures by the WHO following the outbreak of COVID-19. Majority of such persons were left without food, medicine and medical facilities and unable to fend for themselves. Sylvia is just one of such people.
I need assistance all the time, but because of the coronavirus, that has become difficult due to the social distancing measures, and having an assistant around me other than my mother places extra financial burden on me, which I can't afford.
Though the government of Ghana, through the Ministry of Gender, Children and Social Protection, provided free meals to deprived citizens during the partial lockdown, Sylvia could not compete with the able beneficiaries.
I don't always get the nose mask and hand sanitizers, and when I have a friend or an assistant around me with all these PPEs, I have to provide for them, and once again, this places more financial burden on me.
She wants government to ensure that all other interventions are inclusive of people with disabilities, especially the deaf and blind.
I wish the government will pay more attention on us, the deaf-blind, because we can't see nor hear, so information is difficult for us to access. Inasmuch as persons with disabilities are being catered for to some extent, the issues of deaf-blind persons must be taken into consideration, since we solely depend on individuals, especially sign language interpreters.
The Disability Act speaks on decent livelihood for persons with disability. Coordinator in charge of COVID-19 programs at the Ghana Federation of Disability Organizations, Christopher Agbega, revealed only 1,000 of its members had access to the food items distributed by the Gender Ministry out of the over 50,000 members.
There are so many things that could have been avoided if we were meaningfully involved from the onset. I made mention of the difficulty in applying for the coronavirus alleviation package by persons with disabilities carried out by the National Board for Small Scale Industries. That could have been, avoided if we were involved right from the onset.
Again, the coordinator revealed the stress that came with the restrictions triggered psychological trauma among its members.
We may look even just at the economic impact or the social impact, but even adhering to the protocols has been difficult. And for this reason, there has been some high levels of anxiety and depression amongst the disability community because of the fear of not being able to adhere to these protocols.
350 persons with disability applied for the NBSSI stimulus package, but the Federation is yet to receive data on how many of its members got a package.
The few that had received support on the COVID-19 Poverty Alleviation Fund to ensure that they make judicious use of it.
Data from the National Board for Small Scale Industries showed that over 300,000 micro, small and medium enterprises from various sectors of the economy accessed the special fund set up by government to cushion businesses against the impact of COVID-19. The data further revealed that 40,000 applicants who qualified were not able to receive their monies due to some irregularities. However, the board is yet to provide data on the number of persons with disability who benefited from the package. As at May 11, 84 new cases of the novel coronavirus has been recorded in the country. Active cases are 1,314 with 783 deaths. Recovery and discharge stands at 91,146, while the country's total case count is 93,243.